Welcome back. In South Dakota, it's not unusual for someone to spend 75 years or more on the roads and behind the wheel as a licensed driver. But what if you could no longer drive? Thanks for staying with us. In addition to advocacy work in Washington and state capitals across the country, AARP also tackles a whole range of issues. Recently, members of AARP's National Policy Council, a group of diverse volunteers who serve as advisors to AARP's National Board of Directors, spent time in South Dakota addressing the transportation challenges facing older residents in very rural states. Here's a look at their experience.
For most of us, getting from point A to point B is as simple as jumping in our cars. The biggest barriers along the way may be a stoplight or two. But what if getting behind the wheel of your own car or getting a ride from a family member or a friend is no longer an option?
The fact that many of us now, with our life expectancy, are going to spend 7 or 8 years, that's throughout the country, without a driver's license.
Transportation is still what really kind of allows people to live where they want to live and get them where they need to be.
In rural areas like South Dakota, with no subways and few buses, getting where you need to go can be a major challenge. For some, it's a challenge made worse by the miles and miles between home and their final destination.
How do you get your medications? Where do you get your how do you get your groceries? If you need to go to dialysis, we've been talking about health care trips almost the entire day. And it's vitally important that these people get to see their doctors or get whatever medical facilities they have to get to.
Members of the Livable Communities Committee of AARP's National Policy Council spent a week in South Dakota, getting a feel for the transportation challenges those 50-plus and their families face in larger cities, small towns, and remote Native American communities.
We have talked about transportation on many different levels, and we've done a lot of research and looked at a lot of surveys, but you really don't get the feel for it until you're really here.
Going forward, the group will look for ways to address some of the transportation challenges facing current and future seniors in rural areas of South Dakota and across the country.
AARP could do a couple of things on different levels. One would be just serving as an information source. This is what we found out, and then share it with their members. Look, we know you're facing these issues, and here's what we're trying to do. I think you could also use the information, AARP, to meet with state legislators and governors and federal officials and tell them this is a big issue, transportation. And as we gray as a nation, they're going to have to do more. And I think AARP can be an important voice, both in the state houses and in Washington, to try to get them to focus on this more than they are now.
And once again, Sarah and Dennis are here to share a bit more about the National Policy Council's trip to South Dakota and what they learned on that transportation issue. So Dennis, why is AARP working on transportation issues?
Well, in South Dakota, as true across the nation, we have found that it's a lot better for seniors to be able to live in place. And we have so many rural areas in South Dakota where transportation is the biggest barrier to people being able to live in place and still buy groceries and get health care.
Just explain living in place. What might that mean for someone?
That means that, they've grown up in these small towns. Their ancestors probably homesteaded there and live in their home so that they don't have to go to an institution or a rest home.
Sarah, any thoughts on why this is important in South Dakota?
Well, we actually went out and asked South Dakotans about how much they drive and what the challenges that they're facing are. And, we were surprised, although when we thought about it, it makes a lot of sense. 75% of the folks we asked out in very rural South Dakota or in communities of 3,000 people or less drive over 100 miles each week. And, we do have a lot of distances between point A and point B in South Dakota, but if you really think about that, that's a long distances. And half of those people that said they're driving 100 miles a week said that if they couldn't drive anymore, they would have some real real challenges getting to the grocery store, to the doctor, and the places they need to go. And also, over half of those folks also don't have access to public transportation options. And so put all that together, and it's just an issue that we really need to work on, and AARP South Dakota is going to work on it in the coming years.
So Dennis, this group of folks that came, they're from all over the place, New Jersey, Virginia, places that, you know, they have subways and buses. Why was it important for you to bring these folks to South Dakota?
That was exactly the reason, because they have subways and buses. They have no idea about what we face in rural America. So it was important to bring them out here to find out, let them know what the great distances are and the real barriers that our elderly people have to being able to get health care.
So Sarah, what's the role of AARP going forward? Where will this take you?
Well, we're really going to continue to try to figure out what the real basic needs are, what we can do to help meet those. And a lot of that's going to be talking to partners and other folks across the state who want to get involved with us and help make sure that we're meeting these challenges for older South Dakotans, but all of South Dakota.
And the role for the National Policy Council, what will they do?
Again, we're going to assess all of the things that we have found out, put it together, hopefully put policies in place that states are going to be able to use to model some experimental programs to help face this problem.
Excellent. Well, there are still plenty of ways to get involved in that issue as well. If you're interested in working on transportation or any of the issues that we are talking about today, you can learn more by visiting www.aarp.org/SD. You can email us at sdaarp@aarp.org, or just give us a phone call toll-free at 1-866-542-8172. You can also find us on Facebook, follow us on Twitter, or subscribe to our YouTube channel. Just ahead, how AARP's dedication to serving others is making big strides in the fight against hunger.